Hello. How are you today? Oh, yes, the nurse was telling me. I'm sorry to hear that. Panic attacks and anxiety can really take over our lives at times. Okay. We'll deal with that, and we will do the best we can to help you through it, okay? We will continue with the appointment. First, I'm just going to check in with your information right here just to make sure that we have the right person, okay? Excellent. Okay. Please just bear with me. Okay, here we go. Let's just take a look through here. Looks like you have in your chart here, the chart that we have here for you. Okay, and if you can just confirm your first name for me. Okay, perfect. And just your last name as well. Perfect, excellent. That's what I have here as well. And could I grab your date of birth as well? Okay. Very well. Awesome. Okay, perfect. And now can you just give me the reason for your last appointment visit? Okay. Okay. Mm-hmm. Mm-hmm. Okay, okay. And that, and just worried about, okay, just for a little checkup and a little concern. Okay, perfect. Okay, just a few more notes here for me to write down, okay. Okay, excellent. So now that we got that out of the way, we confirm that this is the correct information for you right here. Now, can you tell me if you are aware of what brought on this particular panic attack and anxiety? Okay. Okay, so it's a reoccurring thing that kind of just creeps up on you. There's no real particular rhyme or reason in those moments. Sometimes there might be, but in general, it just sort of happens, okay? Comes out of nowhere. Got you. Oh, that can be really tough, I tell you. The first thing I'm going to take a look at, though, is your breathing, okay? Now, it's important to make sure we're looking at your breathing because a lot of the techniques that are used to calm down from a panic attack or anxiety attacks is just general breathing. Mind you, it's not as easy as it sounds. If you've never done it before, you have no idea how to go about it. Just breathing regularly isn't sufficient enough for that. Yeah. Do you find that you have troubles with breathing at all? No? Okay. So usually you're... Okay. Have you done breathing techniques before? Not particularly, no? Okay. Well, those are some things I can definitely show you today. Absolutely. And I know not only for a lot of other people, myself in particular, breathing seems to be the one that I go back to constantly. Okay, so let's just take a look or take a listen at your heart and see what we got going there, okay? So if you can just take a deep breath in for me, okay? And just let it out very slowly. just on the back here, do the exact same thing. Perfect. Just take a deep breath in for me, okay? And okay, perfect. And now, again, just on this side. Okay, excellent. And deep breath in for me. Okay, and just one last time on the back. Perfect. And deep breath in. And let it out. Okay, heart does seem to be beating a little bit faster, and I imagine that's due to the anxiety and panic attack for sure. Okay, so the first thing we're going to do is, just as I spoke of, we are going to take a few moments to just breathe, okay? Now, the important things to know and learn while breathing is making sure you are inhaling through the nose and exhaling through the mouth. Don't let the breaths become too rapid or quickly, okay? We want to make sure you have enough oxygen flowing through, because that's important for our bodies. Okay, and we are just going to inhale. Hold as you see fit. Good, and breathe in. And breathe out. And again in. And release. And keep your hands planted just on your knees or next to you, wherever you can feel where your hands are grounded to something. So it can be on anything, firmly on a table, on your knees, on your own arms even. Just have it so that you are grounded with something around you, okay, while you're taking these breaths. And breathe in. And breathe out. Very good. And one more time. Breathe in. And breathe out. Okay. Continue breathing that way, okay? And do you feel it helping a little or a lot, would you say? Somewhere in between. Okay, good, good. Just keep up with those breaths, and eventually the breathing will be able to match the level of the anxiety and panic attack, okay? Okay, good, good. Keep up those breaths. Now, within your file, what you were coming for today was to, discuss some of these for sure, panic attacks and anxiety, but you were also looking to just look into cranial nerve a little bit. Okay, and why do you feel that cranial nerve is the right route for you today? Okay, so focus. So with focusing. Okay, absolutely. I think then we'll steer away from the other cranial nerves, and we'll focus just on the light sensitivity, just to see if that focus can be obtained. Okay? And you might be asking yourself why that might be a connection. It's because the sight of being distracted can really go a long way to helping with panic attacks. So if we aren't experiencing the best forms of ways of distraction, like with our hobbies or our work or anything in your day-to-day, if you feel anxiety and panic attacks are breaking those things up, then it's quite possible that it could be a cranial nerve issue that we can bring to light and maybe focus on, and it might give you a little bit more relief when you are busy and you are in tasks and you are more focused. Now, this may not be the case for everyone, mind you, but it is definitely an avenue to look into. And you were that's why. Okay, so you were researching it, and that's why this is what led you to the appointment today. Okay, perfect. Well, we can definitely give it a try and see if that is an indicator or a factor in this at all, okay? We will get you through this. Just remember to keep taking deep breaths, inhaling through your nose and exhaling through your mouth, okay? Okay, so let's get started on the focusing, okay? So I have a few tests in mind for this that do test your focus specifically with movement, okay? So this can be directly related to synapses and connections within the brain, okay? That could lead to these kinds of panic attacks and anxieties, okay? So we're first just going to start with just using just my general fingers here, okay? Now, can you see them out of your peripheral? Okay, you can see them coming in and out. Okay, and just now staring directly at my nose, I want you to tell me when you can see both of them. Not just one of them, but both, okay? And I want you to really focus on how challenging it is to prevent your eyes from looking at either of my fingers coming into your peripheral vision, okay? Okay. 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 Now, can you tell me on a scale of 1 to 10, how tough was it for you to prevent yourself from looking to where those fingers were coming into your peripheral vision? On a scale from 1 to 10, yes. About a 3, okay. So you had pretty well control over it. Okay, that's good. Okay, now I want you to focus on my finger here, okay? You are going to see this other finger coming in and out of your peripheral, but you don't have to tell me when it comes into your peripheral at all. I just want you to keep focused on this finger, and again, stay focused to how tough it is for you to prevent the movement of your eyes to the other finger, okay? Okay. So we're going to keep this finger just right here. Okay. Okay, good. Keep your eye on that finger. Okay. And just keep focused on how tough it is to stay focused on this finger, okay? I'm going to come up into closer distances and further distances, okay? I'm going to be focused on your eyes, making sure that I'm not seeing any movement or twitches that we shouldn't be. Okay. Okay, good, good, good. And while I continue this, scale of 1 to 10, how tough it is to prevent your eyes from looking at my other finger. About a 4. Okay, so it is getting a little bit tougher, would you say, than the last test? Okay, okay. Now the next one is we're going to continue using these fingers. Keep focused on this one. Both of them will be moving though. And then I will be asking you to switch to the other finger, okay? And I want to see how quick your response is to when I ask you to switch your view to the other finger, okay? Okay, and switch to the other finger. Okay, good, good. And switch to the other finger. Okay, okay, very good. And switch back to the other finger. Okay. And switch back once more. Very good, very good. Okay. And switch one more time. Okay. And still following that finger. On a scale of 1 to 10, how hard is it to prevent from looking at the other moving finger? About a 4, so the same as the last one. Okay. Okay, so that's not too bad. A 3 or 4 can be chalked up to a lot of things, as well as being in the midst of a panic attack and anxiety attack. That could be affecting those numbers. So the fact that it's on the lower side, even while having 1, that's better than we could have hoped for. Okay. Yes, the best case scenario, if you will. Very good. Okay, so I think we're going to move on to just using a light as well, just to bring in a bit more of a distracting element, okay? So we're going to be using just my handy dandy light pen here. Okay. Okay. And as you can see, it's just a very mild light. I'm going to try not to shine it directly in your eyes here because it can be a bit bright at times directly in the eye, okay? So I'm just going to kind of go around. And to start, I just want you to follow the light. I'm going to go a lot slower than this. I just want you to follow and focus on that light and follow it around, okay? Okay, good. Very good. And here we go. Follow that light. Okay. Okay. Good, good. Your eyes look to be responding normally, so that's good too. Okay, good, very good. I'm going to come a little bit closer now. Okay, Very good. Okay, good. Good. Your eyes are responding normally, and it's good. It makes me very happy to see. But how do you find the focus is for you right now? You're finding it fairly easy? Okay. Just a 2? Oh, and you feel that your panic attack and anxiety is lowering. Okay. Much more than before? Very good. I'm glad to hear. But now, let's stay focused on this task here, okay? Because like I said, that focus can really help in these kinds of situations, as well as preventing, in some cases, mind you. But it looks like it might be receptible to you, so let's continue. Okay. You said it's about a 2 out of 10. Okay. Perfect. Very good, very good. Okay. Even though I've picked up the tempo, do you find that that's more challenging? No? You're still able to follow it? Okay. Good. Very good. Okay. Well, judging from your response, how do you feel this speed is going out of 10 as well? A 2. Okay. That's very good. That's very, very manageable. And you're able to keep up with it. Good. Okay. So I think those situations seem to be within grasp and within the normal parameters. So we're going to do one more test just to kind of definitively prove if this is going to be beneficial to you. Okay? Okay, perfect. So it's going to involve the light again, as well as my finger right here, okay? Now, I want you to stay focused on the finger. With the light being bright, it's going to be more likely to draw someone's attention, okay? So I want you, again, to focus on how difficult it is to prevent yourself from getting distracted and looking at the light, okay? Fantastic. Okay. And here we go. Stay focused on the finger here. Okay. Very good. Very good. Very good. Okay. I'm seeing a little struggle, but that's pretty normal for a light as bright as this. Okay. And what would you say out of 10 the focus level is? Or the distraction level, I should say. About a 3. Okay. That is wonderful to hear. So that is very average. That's very on the spectrum for normal, especially like I said with the bright light. So I think focusing and breathing are 2 very beneficial things that are going to help you with your panic attacks as well as your anxiety. I really do feel that that's going to cut it down for you in size, not only with the being able to focus on tasks and having a straight goal in your mind connected to that, so that you just keep pushing through and your brain just has that goal and wants to reach that goal. And then combining that with the breathing techniques, I feel that these will cut down your anxiety and panic attacks by a significant amount. So I urge that you just practice these techniques at home and try focusing techniques as well, and then taking it from there. Based on everything I've seen with your results, you should have no problem with conquering these. Now, mind you, there's still going to be moments where you have those attacks, but they're not going to feel as severe, and you will feel a little bit more in control with every deep breath. Oh, good. I'm glad you're feeling much better. Well, how about this? You come in a couple weeks, and you let me know how you're doing with those, okay? Good. Very good. Absolutely. I would love to have you back for a checkup. Check in and see how everything's going. Absolutely. It's my pleasure. I hope you have a wonderful rest of your day, and I will see you at that next appointment. All right. Take care.